This video is on systemic sclerosis, otherwise known as scleroderma. Um, there is a real uh, issue as to whether this is an integumentary disease. It Most of the symptoms do end up in skin, or is it a musculoskeletal disease, or is it an autoimmune disease? It really doesn't matter where you categorize it; it still is the same. It's found in your textbook on page 33 and 34. There's a brief talk about it as systemic sclerosis, and then again a little bit more in depth on page um, 220 through to through to 224. Um, so, like I say, in the vernacular, it's most commonly called scleroderma, and you'll hear it referred to as that. But the more accurate name now is systemic sclerosis. Sclera means thickening, so scleroderma means thickened skin, where systemic sclerosis means thickening everywhere. Now, what this is, it's an autoimmune attack on the lining of the blood vessels, arteries, veins, and capillaries. It's So the endothelium gets attacked by autoimmune, and it causes an inflammation. And when that inflammation is caused, then the fibroblasts in those blood vessels, in the walls of those blood vessels, start pumping out collagen really quickly. And it does a bunch of things. It starts to resemble almost scar tissue, but any place where there's a lot of vascularization, it starts to harden up, to get thick, to almost get scarred up. And yeah, so it's really this kind of problem of chronic inflammation, autoimmune inflammation at blood vessels, causing scar tissue to deposit around those blood vessels. So as you can imagine, it can affect just about anything. But the skin, the dermis of the skin, is very highly vascularized, and so this becomes the most common place that it presents. Um, 300,000 people, more women than men get it. Uh, about 4 times as many women as men get it. So this, so the immune system attacks the lining, and then you get this local edema, and then because of the edema, you end up with fibroblasts being stimulated, and then you get lots of collagen made. It can be diffuse. It can be anywhere in the body, or it can be anywhere on the skin, for that matter. But it tends to form in patterns. So we can have local type, where the problem is just localized, and so it's only in the skin. It may be reversible. It may spontaneously disappear, and it comes in two forms. One is kind of this oval patch, Morphea, or one is kind of a linear patch, discoloration. They call it sword cut or coupe de sabre type patches, because it looks like slashes across the body. The one that we're more concerned about is the systemic scleroderma. So the blood vessel damage happens anywhere in the skin. So it's systemic sclerosis. It happens in the digestive tract, in the heart, circulatory system, kidneys, lungs. So, so it comes in a couple of different forms. One is a limited, slow onset. Another is more diffuse, kind of a more sudden onset. One, it may not even involve the skin. You can imagine that this is going to have profound impact on circulation, and a lot of the symptoms that people see and a lot of the complications that they get have to do with a lack of circulation or high blood pressure trying to overcome the circulatory issues. So what causes it? It's some sort of an abnormal immune response. It's an autoimmune attack. The chimeric cells really are cells probably from a fetal origin that are found later, years later, in the woman who had given birth. Various infections, chemical exposures, especially solvents, seem to be involved. Who knows? Again, there's multiple factors, so it's probably multifactorial. There's got to be a genetic basis to it as well. So, what do we see? Like, what are the clinical manifestations in this? They really, there's 3 stages in the clinical manifestations. The first stage we get is edematous. This is when the inflammation is new and it's happening, and the blood vessels, because of the inflammation, are leaking out, and you get edema. Then, following that, is when the fibroblasts start to make the collagen, and we call that the sclerotic stage. And then after the sclerotic stage, you can imagine that you're going to end up with the tissues not being very well nourished. And so you end up with an atrophy, an atrophic stage. So the skin will actually maybe ulcer, or especially at places where it bends and is stretched very taut. There's this concept of the crest syndrome. So this is the mnemonic for what you see. Calcium deposits accumulate in the skin. Now, a lot of people with this, it is limited. So it's found in the distal extremities and in the face, and this is where we get this crest syndrome. So that's why the calcinosis accumulates in the fingers. Along with that is something called Raynaud's phenomenon. And Raynaud's phenomenon is this sudden blanching of the extremities. You may get cyanosis, arrhythmia of the toes or the fingers. Depending on where it happens, it may only be one finger, it may be multiple fingers. What happens is the blood vessels that supply that area become narrow, and blood can't pass, and so you basically get a loss of circulation. It looks like, when you see it, it looks like somebody's had like an elastic band wrapped around their finger, and so it kind of gets that exact look, and it's a spontaneous and it's sudden when it comes on. Another thing that people get is esophageal dysmotility, so difficulty swallowing. And they may end up with GERD, gastric reflux disease, gastroesophageal reflux. The esophagus is very highly vascular, and so if the blood vessels are impaired, then it's not going to work as well. The other thing about the esophagus is if collagen starts to deposit, it's difficult for the esophagus to stretch to allow swallowing. Sclerodactyly is really thickened fingers. Dactyl is fingers, so sclerodactyly is thickening and hardening of the fingers. Telangiectasia. Telangiectasia. I can never pronounce that. It's one of those things. It's easier just to say spider veins. Those are the little red spider veins that happen on the face and on the backs of your hands and things like that. And that's common with this limited systemic sclerosis, scleroderma. The fingers start to look like this, and you can see the clubbing of the distal fingers, the ulcerations on the little fingers here. You can see the tightening of the skin through it. And you can imagine that it's painful and difficult to flex. You can't flex the fingers if the skin across the back of them is tight. And that actually leads to muscle atrophy because you're not actually using those muscles because the joints don't move easily. So that can be a big issue. You get this marked weakness, almost kind of like myopathies from it. It says in your textbook that nearly 50% of adults with scleroderma have other symptoms such as depression, sexual dysfunction, trigeminal neuralgia, hypothyroidism. You can just imagine a lot of that is vascular based. They get skin ulcers, changes in pigment, hair loss, because you can imagine that if the hair follicles are not being nourished, then the hair falls out, the muscles get weak, connective tissues swell. Lung damage. You just think of how many capillaries are in the lungs, and if the lungs start to get excessive collagen deposited in it, it's almost going to be like a fibrosis of the lungs. Make it very difficult to breathe. Angina can happen. Pain in the heart because the small blood vessels that supply the myocardium have difficulty. Different arrhythmias can happen because of it. Heart failure is a big problem because if you get trouble pushing blood through the lungs, then it backs up into the right side of the heart, and you can get a right-sided heart failure for it. Blood pressure tends to go up, which then can damage the kidneys, and if the endothelium of the glomeruli in the kidneys are affected, then filtration isn't going to be adequate. It becomes a real problem with kidneys. The trigeminal neuralgia and the carpal tunnel syndrome are really entrapment syndromes of nerves because of collagen deposition in the small spaces that those nerves have to go through. Sjögren's syndrome is dry mucous membranes. And again, you can't create moisture if you're not bringing adequate blood to that area. So all they can do, this is a systemic autoimmune disease, so all the management of it is to manage the complications, to manage the Raynaud's phenomenon, the blanching of the fingers, to maintain kidney function, to antacids and things to stop the gastric esophageal reflux, painkillers for joint pain, immunosuppressors to try and to put down the immune system. This is a very real problem because it's autoimmune. These people have to really avoid things that are immune boosters, things like echinacea, that kind of thing. Smoking causes peripheral vascular damage, and these people don't need any more peripheral vascular issues. Cold temperature causes vasospasm in the skin and the extremities, especially in the fingers, which then again will exacerbate this. Oftentimes, people with Raynaud's phenomenon, the trigger is the hands getting cold. That there's adequate blood gets there, but as soon as there's some coldness, then it's like this overreaction and shuts down the blood vessels. For some reason, spicy food seems to also cause that. Maybe it diverts more blood away from the skin and into the digestive system, leaving less blood to overcome these restrictions in the skin. You got to be careful around these people, especially with joint mobs and things like that. If the joints are affected, the skin can be tight enough that it almost acts like a ligament. Circulatory issues are a main concern, and then kidney health follows that. So it's something to ask of your massage therapy theory people.